All this is Dr. Mobeen Sayed from Drbeen.com. Welcome to one more show. The discussion I wanted to do today was to compare vaccines once again and discuss the point that why does Moderna say that they have their vaccine is 100% efficacious. So important thing. So let me just talk about that and then we'll go to the CDC's discussion. What is really interesting, and I think this is true for Pfizer and for Moderna both, that none of the patients that got COVID after the vaccination, none of them became severe to end up in a hospital. So that is a huge deal. So Moderna also said that 100% of their patients, so that means people who received Moderna's vaccination, then out of them, the ones who actually did still get COVID, none of them had to go to a hospital. So I think that is a good thing, that the vaccination at least prevents, if it cannot stop from getting infected for some people, at least it prevents them from ending up in a hospital or becoming severe. So that is a great news. So having said that, today CDC and their committee, they have a committee of 14 people, majority of them doctors. I think one person was not a doctor. They sat down together, they took people's comments. I think they were live on Zoom and Ustream. And then they decided who should get the vaccine first. So I wanted to talk about it, that how are they thinking and what are they doing and who is going to get the vaccine first? When are we going to get the vaccine? So let's look at it. So again, this is Drbeen.com. And so now we'll stay in a discounted plans for this month as well for the holidays. Now, here is the CDC's link to their advisory committee on immunization practices, or ACIP. So if you see here, excuse me. So this is Advisory Committee on Immunization Practices, ACIP. This committee, I was able to hear some part of it live and see how they are recommending. And this was their live link. This is their agenda, and this is their presentation. I'm going to go over some part of this presentation today. This is that presentation. And then here is a very interesting article. Many of you have talked about adjuvants in the vaccine, which may then trigger the immune system and cause damage. So I wanted to make sure that we are comfortable or we understand. So far, the messenger RNA protein vaccines, for example, Moderna's vaccine or the Pfizer's vaccine, they claim they do not have adjuvants in them. The reason for that is that the lipid particle itself acts as an adjuvant. What does that mean? Adjuvants, and I'll do a separate talk about it, the adjuvants and their role. But generally, the idea is that an adjuvant with a vaccine is something that kind of makes the antigenicity of the vaccine increased, number one. Number two, some of the adjuvants that are added to the vaccines, they trigger the immune system to respond. So this is like you have a little thing that would tickle the macrophages. So when you inject the vaccine, these little molecules are going to go and tap on the macrophage and say, hey, guy, look what we have here. And the macrophage will become triggered and it would pick up the antigen and start making the immune system's response. So these kind of try to enhance, because the vaccine is given in a small area. So the immune system over there is really not a lot of cells. So you got to kind of trigger them and stimulate them to say, hey, guys, respond. So these are excuse me. So these are usually the adjuvants. In case of messenger RNAs, they do not have adjuvants in there. They say that the lipid particle itself can act as an adjuvant as well if needed to enhance the immunity. So with this article here has a very thorough discussion of what are adjuvants, what is their role, and what vaccines are using which kind of adjuvants. So if you see here, just a few things here. As you can tell, it's a very thorough and exhaustive article. So look at here. The exact lipids used are not stated. So he's talking about the Moderna and Pfizer. The exact lipids in the lipid particle used are not stated. The mRNA containing lipid nanoparticles are solubilized and injected directly into the deltoid muscle. So the muscle of the arm, upper arm, outside muscle. Moderna does not explicitly state the use of an adjuvant, but the LNP carrier may be an adjuvant since other lipids have been reported to have adjuvant properties. So the lipid itself is maybe the one. Similarly, they talk about BioNTech, Pfizer's messenger RNA protein as well, and they say the mRNA is modified with single nucleotide incorporation of 1-methyl pseudouridine, which not only reduces immunogenicity of the mRNA in vivo, but also increases its translation. And they have talked more. And so I went through this article and looked at the discussion. If you are curious about the adjuvants, their role, if they can be good or they can be bad, I would recommend to look at this article. So now let's go to my illustrations and the presentation. So here is the illustrations. So first of all, the interim immunization practice that was approved today, the basic process, what they did was they had various communities, groups, and they took a survey from Americans to say, who do you think should get the first vaccine? So after the survey's response, then the committee sat down as well, and then they decided and they voted on what should be the first, who are the people who would receive it. So here is what they approved. There were 14 people in that committee. 13 said yes, 1 said no to this proposal that was approved. The proposal was healthcare workers who are 21 million in the US, they get the vaccine now, the first session, first phase, and the residents of the long-term care facilities, these staff plus the residents of the facilities, they would receive the vaccine first. And then I'm going to go over how about others who, for example, policemen or food workers or agricultural workers or teachers or other folks, essential workers, and so on. So we'll look into that in a second. This was approved by 13-1 vote. A survey was done for the American community. So here is how this phase was done. So this is me trying to draw. Today I had to draw underneath and then draw over it. So these cartoons probably do not look that beautiful, but still I'm trying. So in phase 1, the phase 1A, these are the folks who are going to start getting the vaccine now. There are healthcare workers, and then there are long-term care facility residents. After that, essential workers in phase 1B. And I think these phases are guided by the availability of the vaccine itself. So essential workers, for example, education-related folks, police, food and agriculture-related people, utilities, firefighters, corrections officers, transportation officers, and so on. I only drew a few of them, but of course, there are many, many kind of categories here. Then phase 1C are the folks who are at high risk. So they may be high risk because of comorbidities, or they may be high risk because of, I believe, ethnicity, or they may be high risk because of their age. So that is how they have laid out the phases of the vaccination. In my opinion, if there were enough doses available, then they probably didn't have to phase them like this, because then, for example, all of the point of care systems or CVS or Walgreens, they would have the vaccines there, and they would say, whoever wants to have the vaccine, please go to your doctor or go to CVS or Walgreens and get your vaccine there. So I think because the doses are less in the beginning, they have to sort of prioritize. So now, one question that I have for you is that, what do you think? Who should have received first, or do you agree with how they prioritized it? I'm very, very curious for your opinion. And now let's look at the presentation a little bit. This is an interesting presentation. So here, I'm not going to go over everything, but this was their basic guiding methodologies. So they said we should look at the science, then ethics, and implementation. So the science part, for example, for every group that they decided, for which they explained that, all right, here is the science behind this. So for example, phase 1A, healthcare workers and the long-term facilities. Over here, they're saying that science is the COVID-19 disease burden is a lot, balance of benefits and harms of vaccine. So that is what they are considering. And please realize this, in the workers, healthcare workers are the ones who cannot avoid the exposure. They have to go to hospitals, they have to go to point of care systems, they have to serve. This is what they do. So they have no way of avoiding the exposure. Yes, they can wear personal protective equipment, they can do social distancing, they can do masks, everything is possible, but their exposure is a lot more than the rest of us. And the reason is we all have a standard exposure that we go out, we have a possibility of catching the virus. Healthcare workers go out and they have the possibility of catching the virus, plus whenever they are at work, they have a very increased potential to catch the virus. So science is one. Then, for example, implementation, values of target group and feasibility. So they're saying is that the value of the group itself, for example, later on they say that if healthcare workers, they die or they become sick, then there are absenteeism, and then the healthcare staff is reduced, which further deteriorates the healthcare system's capability to take care of the patients. And then ethics, for example, they want to maximize the benefit and minimize the harm, promote justice and mitigate health inequalities. And how, for example, I read through this, how did they kind of justify this for healthcare workers? One, the benefit of immunizing a healthcare worker is that, number one, the staff stays full capacity. Number two, because the staff themselves are not becoming sick, they would not spread that to other patients. So that is a maximizing the benefit. It is multiplying the benefit. And then the promote justice, healthcare workers cannot avoid being exposed. So it is kind of just for them, it is justice to kind of take care of them first. And then mitigate healthcare inequalities. They say that in healthcare workers, there is a large proportion of those folks who may be, by their ethnic roots, more at risk. So it kind of helps them in that way as well. So now I want to show you this. This is what I just showed you in drawing. So phase 1A, healthcare personals and long-term care facilities. Phase 1B, essential workers, examples, education sector, food and agriculture, utilities, police, firefighters, correctional officers, corrections officers, transportations, and so on. Then 1C, adults with high-risk medical conditions, adults 65 plus. So if you see then here, this is a little more data for what is a healthcare personnel. Their number is 21 million, and so that is here. And who are the long-term care facility residents? And that is the definition here. So about 24 million folks. Ideally, for these 24 million, we need 48 million doses. So if you think about, I believe Moderna had said that they would have 50 million doses available. So I think the number of doses are less, so they may be good for these folks in the first wave. And then as more vaccines come, for example, Pfizer has started sending the vaccines over. The very first flight with the vaccines has arrived, and the vaccine has been sent to the cold storage. What I do not know is what is the quantity of the dose in there. So as the quantity increases, there would be an overlap that while healthcare workers are being vaccinated, others would start getting vaccine as well. So then this is an interesting data point that as of November 30, at least 243,000 confirmed COVID cases among healthcare professionals. So 23 million 21 million professionals. Over this period of time, 243,000 became sick, and then 858 died as well. So that is, of course, every death is a tragedy. And then in the long-term care facility, they say that if we can, and the reason why they're going for the long-term care facility, of course, they are the vulnerable part of the community, and so taking care of them is just very, very important and a good human thing to do. The other thing is that the um, death percentage is the highest in this community because of COVID. So it is also important to take care of them and to protect them first. So here, once again, some data for the older. So look at this. Long-term care facility residents and staff accounted for 6% of the cases in the US and 40% of the deaths. So that's a very high number. Then this is the hospitalization. Again, as the age advances, the group becomes more vulnerable, and then the hospitalizations show that similar pattern. This is what they had gotten. So survey respondents. So they had done a survey. They used Harris poll. So they did a survey of the some Americans. The number of people who responded was 1,399, and this was the people's priority to get the healthcare workers, and then senior, then immunocompromised, then essential workers, fire rescue, police, teachers, highest incidence areas, children, young adults. So this was a priority in which Americans, a slice of it, a very small slice, 1,399 Americans had kind of prioritized. So then when asked that what is the phase, what are the two top, so these are the two top groups that were selected. This is where they have put those principles that there is maximizing the benefit, promote justice, mitigate healthcare, and they have explained that why do they feel that these two groups need the vaccination first. And then they've talked about science and implementation and ethics. And that's it. So this is what is happening on the CDC side. Tell me this, how do you see it? So we are only 18 minutes into it, maybe another couple of minutes, and I can look at some comments and have a discussion, and then we would stop. So Fair Parker says, as a person of color and a nurse, I have noticed people I work with who seem to have more health challenges are getting COVID more than others, regardless of color and skin, which is totally possible. The reason is the exposure. Doctors should be wearing masks. Wow. So he works for MedStar and doesn't wear a mask and parties during a pandemic? Who is that? That's not right. Arun says, my opinion, we should make an algorithm which includes vitamin D, cardiac tissue issues, diabetes, asthmatics, profession, pediatric, and then let the algorithm learn. That is a very good idea. I think that vitamin D, vitamin C, ivermectin, zinc, quercetin, these should be part of a standard care at this time. The problem is they have not approved these kind of basic methods to protect people. So 08 KLM says center of traffic like grocery stores, gas station workers, that is a very good idea. So that is almost the same thing as healthcare workers and as the nursing homes, because these become the hotspot to spread the infection. So Cindy says, vaccinate the theme park staff and tourists. Absolutely. Absolutely. I would love the society to open up. So as much as when we move about in the open society and we go to our works and we are happy and we are sad and we are angry and we are upset and we are arguing with someone and we are coming back with heartburns, I think we would still love to go back out in the community and go back to normalcy. So hopefully with these vaccines, that chance would accelerate to go back out. So 008 KLM's question, how long might Pfizer vaccine keep healthcare workers out of work? Why out of work? For example, because they'll receive the vaccine and feel the symptoms couple of days. And usually the symptoms are mild. Yeah, so John Snyder, 1A makes sense. Hospitals are probably amplifying this like SARS-1. Absolutely. Hospitals are, not only the healthcare workers are becoming sick, but hospitals are a place to distribute the virus to others. Not only healthcare worker, one person goes from one person and catches the virus and goes and gives it to so many other patients. And that is a high risk group anyways, because they are ill and their immune systems are not working correctly. And on top of that, if the viruses are spreading everywhere, it's an issue. Cindy, I suspect that there will be an allocation of vaccination for military as well. I suspect that that must happen. So, M. Gregory, I was seeing here that there is actually no mention of military. So my thought was that this is more of a prioritization for civilians, and the military is probably a totally different section and segment, and they are probably prioritizing and allocating the dosage for them separately, for which maybe the civilians do not have a say. That is why they didn't have them in the survey, they didn't have in the segments. I think that is because military has a different way, a separate treatment, which is fine. Jim Marek says, I'd like to be in a study comparing those with high vitamin D3 level and no vaccine with those that has been vaccinated. That is an interesting one. I would still like to get the vaccine. So Zilona Papuga, you're very correct that the youngsters are the spreaders. However, if we can protect those who are going to become infected and have severe outcomes, that is also a good idea. But I understand that, yeah, protect the spreaders so they don't spread. And that can also quell the problem. So Steve says that I would reverse 1B and 1C. So you would go to the at-risk communities, advanced age, before the essential workers. Very interesting. Shahida says it is okay the way it is. Barbara says, hi, cool beans, Dr. Bean, Luffy and team. Barbara, there was a question for you. You had said that as a long hauler, you had been using ivermectin, and somebody had asked you a comment that, hey, did it help? So we did not hear back from you. If you can comment on that. John Chipman says, I will definitely get the vaccine. I'd rather the side effects of the vaccine over consequences of actual virus. And side effects of the vaccines are fewer and lesser, and the consequence of the COVID to severe cases is also blocked. A Simple Garden says, I asked Dr. Sayed if I should get vaccinations, POS for COVID in March. He said no need for maybe 2 years. If you have developed the symptoms and you have the antibodies, then previous infections in the data says that the antibodies can stay on for 2 years. So fortunately, we are in it for 1 year. The numbers of reinfection, although there are a lot of reinfections, but they still are so less that for me to think that folks who had become ill with COVID and recovered, they need the vaccine is probably not needed. Their body already took care of it. Siddhartha, thank you. Arun, thank you. Pasi, me neither was an idea. That's why I ended. Okay, so sorry, some other discussion. Cool. So Jana Taylor says, do not get the vaccine. Jana, any thought on why not? GS says, I'm a bit late in the conversation, but in the country I live, officially almost no deaths, 16, 10 months. But they want to inject 30 million people for something that is not killing people. That is interesting. Agreed. So Joe Carlson says, after this first initial shipment, have subsequent shipments been announced yet? No, I haven't heard. Although I know that Pfizer has a plant here that is going to start manufacturing vaccine here as well. But I think this first dose came from Belgium, if I'm correct. The overall doses, Pfizer has said that they would have now, I hope I'm not misquoting them. So if I'm wrong, please forgive me. I believe Pfizer has said that they would have 1.3 billion doses in 2021. And Moderna has said a similar number for 2021. I think within this year, the number of doses available by both companies is going to be somewhere from 50 to 100 million. So the people who can be vaccinated in the US are going to be anywhere from 25 million to 50 million. That is why I think they are prioritizing. AS has a question. Do you think that they will give the vaccine only to those who have not had COVID previously? It would be interesting to do that way. But I do not know if this would increase the logistics and the expense to first get the antibodies and then do the vaccination. I think they're just going to say, okay, whoever is here, get vaccinated and done. But that is just my thought. So Anju says that what about the people who are getting reinfected? So if there are folks who are getting reinfected, we got to figure out what is happening with them. And honestly, if they are getting reinfected, then even vaccine is not going to help, because vaccine is really acting like the virus itself. And so if somebody got the virus and then their immune system did not respond, how will a vaccine help to create the response? It is similar thing as an infection. So what we will have to figure out is what is going on with someone who is reinfecting. Okay, so GS was talking about Thailand. So Rakesh says, I've developed immunity to the disease. Should I take vaccine? So Rakesh, decision is yours and your doctor's. But my opinion is that if you have developed the antibodies, you have fought the virus and you have conquered it, you do not need the vaccine again, because the infection itself acted as that vaccine for when you have developed the response to it. John Snyder says, if you get a vaccine, the pharmacist will give you a lollipop. Can they give us a lollipop without the vaccine? So Jana Taylor says, find reports of those that have already received it. You will see. So Jana, we have been, at least in the Cool Bean community, we have been very, very up with the vaccine discussions. So we understand the mechanism of the vaccine. We understand who have received it. We understand and we have seen the data for what kind of after effects were there. So I don't think that the cool beans here are unaware of the issues with the vaccine, both positive and negative. Cool. So there's a question, couple of more questions, then we stop. Steve says, my sister and her kids recently recovered successfully from COVID. Would I now be safe to visit them in their house? At least if they have recently recovered, hopefully within 4 or 5 days after that, they are not contagious anymore. So one, if you bring the virus to them, ideally they should not get it again. And secondly, they will not transmit it to you. Again, the orophycal route can continue to shed the virus up to 59 days after the recovery. So washrooms and the cleaning habits and then using the restroom and then flushing with the open lid or closed lid, these are still the areas of risk, but generally from the oral side, the contagiousness reduces. Cool. So, so 008 KLM says, will there be a charge for the vaccination? So I believe that the charges, if there are any, $10 or $19, or Moderna, I think, is $29 or $30. What I know is that the government is going to take up those charges. So it is going to be free. But even if it is not, I think these hopefully are affordable. And talking about the charges, I wanted to ask the cool beans here. You may know one of the cool beans. Her name is Nina Kant on Twitter, who once sent me that mask as well. Nina is and I'm only explaining that data or that information that she has put out on tweets. She is a janitor. She earns about $18,000 a year. She does not have health insurance. And I've been thinking about her for some time. Would there be, I think Kaiser's family insurance is $1,165, $1,200. Would there be 11, 12 people for 1 year who can pitch in $100 a month for a year, and we can get her health insurance during this pandemic? Hopefully that would be useful. If there are any, please tell me, and we can, I think 15th December is the cutoff point to buy the insurance. And I really thought that we should try to help her. She has not asked for it, but I think we can. I think we should do this for as many as we can. So Shahida says in Bangladesh the charge is going to be US dollar, $20. Good. 85 says, is Dr. Najib your brother? Yes, he is my real brother. 5 years older than me, 4 years older than me. And we used to actually teach together in the beginning. We both have done medicine from King Edward. And yes, he's my real brother. Sometimes folks say that you're just your cousins or friends and just call each other brothers. No, he's my real brother. Yes. Siddhartha says, I like the idea. Please start a GoFundMe. So I will do that. So I'll do 2 GoFundMe. One for some folks who do not have health insurance and try to get them insurance. And secondly, for the book. Margaret says, absolutely, please. So thank you, Margaret. Cool. Kaiser Permanente has a financial aid program. So I'm going to ask her to look into that as well. Cooper says, who knows what the effects are in the years ahead? So the important thing to notice is the following. From this vaccine, especially the messenger RNA technology vaccine, at the end of the day, we are making the same protein that the virus has. So ideally, whatever are the virus's effects, probably similar effects. What I do not know is the long hauling. I feel that long hauling will not occur because the whole virus and the destruction by the virus and the immune system's disruptions will not be there. It's just a small quantity of just the hand of the virus, which is the spike protein. So ideally, in theory, this should not happen. We'll see as the time passes, but from medical sciences mechanisms point of view, I'm not too worried. So Croc Island Man says, John Taylor, you need a steroid if you're a long hauler, asked Dr. Bean. Yeah, so fish oil, statins, ivermectin, and pulse of steroid. My patients who have been long haulers always, without fail, 1 or 2 courses of steroids and they become better. So John says, I have been on them. So maybe Jana, tweet to me and we can discuss a little more. Logic has a good community announcement. Clorox wipes are available in Staples if you can't find them. So thank you. Cool. So I think this is it for today. Thank you very much. Please like, subscribe, and share. If you wanted to support my work, there is a link in the description for that. And I would see you tomorrow. Bye-bye.